Good morning, everyone. We're going to just give a couple minutes for people to get in and get on to the Zoom, and then we will get started. All right. Good morning again. I'm Heather Tritton. I'm the CEO of the Colorado Children's Campaign. I'm going to get us started. It looks like our numbers are slowing down a little bit coming in. Um, so again, welcome. This is our 2026 Policy Priority Community Briefing, our first one of the session. We're going to do a series of 3 of these like we did last year. So we're really excited to talk to you today about what we have planned. I'm Heather Tritton. We also just wanted to do a little housekeeping here. Please put your questions, if you have questions throughout, please put them in the Q&A as opposed to the chat, because that will help us keep it separate from chatting that's happening. Please feel free to chat all you want. But if you put your questions in the Q&A, then we'll make sure that we don't lose them in all of the chat. We are recording this and we'll send it out and share it, and it'll be on our YouTube and all of those great things. And then we're going to do questions at the end. So please, throughout, put the questions in the Q&A, and then we will come back to them after all of the staff have presented on their sections. And I think that is all my housekeeping. So let's get into this. Well, I'm going to do a little background on the campaign and talk a little bit about federal stuff, and then we'll get into our state legislation. Here at the Colorado Children's Campaign, we believe that every child deserves a seat at the table when we're talking about public policies that impact their lives. And we also know that kids can't vote or run for office. So we at the campaign are their voice and their champion. Oh my goodness. The Colorado Children's Campaign has been the proud voice of children in policy and advocacy in our state for more than 40 years, and we're excited to continue doing that work. We work to make Colorado the best place to be a kid and to raise a kid. We use data and research to identify what kids across our state need most, then advocate for policies that strengthen their well-being and help them thrive. Our focus is on the whole child, working across 4 areas: early childhood, K-12 education, health, and economic security, because we know that these are the areas that create the greatest long-term impact. So we are meeting today at a time of real uncertainty, and I know we have put out a lot of information about these federal freezes and all of the things that are happening. But we wanted to just make sure that we were all on the same page in terms of what has been happening both in Colorado and across the country when it comes to these federal impacts on programs that serve children. The federal decision 2 weeks ago to freeze funding for childcare, TANF, and child welfare programs is just the latest in a troubling pattern from Washington. And all of that stuff that happened a couple weeks ago comes on top of HR 1, which was passed last summer, which was already putting some significant pressure on Colorado's budget and forcing difficult trade-offs at the state level. HR 1 constrained flexibility and increased costs for states at the same time that federal support is becoming more unpredictable. So from cuts to SNAP and Medicaid to impounding K-12 funds last summer, freezing food assistance, issuing dangerous vaccine recommendations, and driving up health insurance premiums, all of these actions collectively are really undermining children's well-being and family stability. So while we are relieved that a judge has renewed a temporary restraining order for the next 14 days on the funding freezes, and he appears to be inclined to keep those funds unfrozen, that pause does not erase the harm that has already been caused and the chaos that has been around it. And that's really creating a lot of instability in our system. Families, providers, and advocates are still operating under all of this uncertainty about whether critical supports could disappear again. And programs serving children should not ever be subject to these political attacks and sudden disruptions. Colorado kids and kids everywhere should not be caught in the crosshair of political games. At the same time that all of this is happening at the federal level, our state is facing another round of painful budget cuts projected to be at more than $850 million, with Medicaid really bearing the brunt of that pressure. Despite these challenges, many programs that benefit kids are largely being protected or maintained, and we feel very fortunate that our legislature and the governor's office have been prioritizing these programs. That outcome and that protection is really a testament to the sustained work of advocates and all of you on this call over so many years. And it really does show the power of collective action. Priorities like public health insurance for undocumented kids and pregnant people through Cover All Coloradans, universal pre-K, and the new public school funding formula currently appear to be protected and have broad support. Still, we have a lot of work ahead of us to make sure that commitments hold through the full budget process. There are a lot of pressures this year. We recently got a briefing from our lobbyists about what to expect for this session's outside of our issues. And she highlighted a volatile mix of federal attacks, funding cuts, a lame duck governor, leadership term limits, and inter and intra-party tensions. So all signs point to a contentious legislative session where there's a limited political will or courage to push Colorado forward to do big things. This is where the campaign comes in. So we refuse to be paralyzed by this uncertainty, and we know we can do big things for kids in the state, even with all of these constraints. And we believe that when kids have someone fighting their fight, they can focus on simply being kids. This moment that we're in right now demands more than pushing back on the White House. It demands leadership here at home. Colorado has to chart its own path forward by building modern and more flexible systems that protect kids no matter what's happening in Washington. Our 2026 policy priorities lay out that path by modernizing the safety net to help families achieve financial stability and avoid gaps in support. We will guarantee affordable and high quality healthcare for every child and family with stable coverage and real access. We want to make early childhood care affordable, accessible, and effective by addressing wait lists and supporting quality programs. And we will work to fully fund our schools and ensure students with special needs have the resources and protections they deserve. Together, these steps form a comprehensive approach to protecting children, supporting families, and building a strong and more equitable future for Colorado. So our amazing policy staff is going to walk you through problems, priorities, and opportunities across each of our issue areas. I think we have put the 2026 policy priorities document in the chat, so you can use that to refer throughout this discussion today. I also always want to note the hard work of our amazing Children's Campaign staff who have put in long hours for several months in order to have a successful policy agenda. They have had meeting after meeting, Zoom after Zoom, and coffee after coffee leading up to now. And more than building a fantastic policy agenda that we and you hope you are proud of, they have built tremendous relationships, and those relationships with our partners and our stakeholders and our relationships with legislators are what make this happen. So throughout this presentation, you will see several priority bills already introduced with heavy hitters leading the charge. So we have folks like the Speaker and President, chairs of committees, and joint budget committee members, all working for kids in Colorado. And because they are big heavy hitters, we know that we can hopefully hit a home run for kids this year. So I am going to kick this over to Tony Sarge, who is going to talk about our health portfolio.
Thanks so much, Heather. Good morning, everybody. It's so great to see you all joining this morning. We really appreciate your support. I'm really excited to talk with you about our health priorities this morning. I've been our health director here at the campaign for about 2 years now, a little over 2 years, and somehow this is my sixth legislative session, including our special sessions. So we're excited to get geared up for another year here. So in the budget, as Heather already alluded to, health has been a big challenge. Every session that I've been a part of here in Colorado has had a tough budget, and this year is not new. Healthcare has been really center stage with the combination of the federal impacts of HR 1 on both Medicaid and the private health insurance marketplace, in addition to our own state budget shortfall. So this has really put a huge emphasis and focus on one of the largest expenditures in our state budget. Joint Budget Committee, or the JBC, has already tackled a lot of these huge cuts proposed by the governor to both curb Medicaid spending over the coming years and have these difficult conversations about what we need to do as we continue to be restricted by TABOR in our budget. So one of the first things that we're really looking forward to tackling here at the Children's Campaign this year is our Health Insurance Affordability Enterprise, or the HIE. So in the private insurance marketplace, the HIE helps Coloradans afford health insurance through 3 programs: reinsurance, health premium subsidies, and the OmniSalud program. This enterprise is struggling to maintain the funding necessary to ensure that health insurance for all of our communities in Colorado stay affordable, especially in this changing federal landscape. Specifically, OmniSalud, a program for undocumented Coloradans or other Coloradans who can no longer access Medicaid due to federal changes in HR 1, has continued to struggle to maintain the funding that we need to keep folks enrolled year over year. So this year, in order to keep Coloradans covered at the level of coverage that we have for the coming year, we need to raise $139 million in revenue for this enterprise. So we're working really hard to achieve that. Especially coming off of the special session we had in August, where this was one of the big areas of focus, and we did achieve some short-term fixes for the enterprise over that time. So we're continuing to kind of seek some of those fixes, to continue some of those fixes, and figure out some more stability for that enterprise to come. This bill has not been introduced yet, but we will keep you all updated on a bill number as the stakeholders continue to meet on this complicated and critical issue. We're really thrilled to check in on the success of the Cover All Coloradans program, which is a state-funded version of Medicaid focused on children and pregnant and postpartum adults here in Colorado. This program has been up and running for a little over a year now, and the program now covers 20,000 children, which means 20,000 children in Colorado are getting access to well-child visits, immunizations, and oral health care when they previously were not able to access these services. This program has also been included for proposed cuts in the governor's budget. At this time, the program has not changed. It remains the same, but these proposals do include some program shifts to save costs, such as dental caps and shifts in behavioral health service payments. And mainly those proposals were put in place in order to maintain the enrollment and eligibility levels that we have for the program right now. We're going to continue to push for this program to continue to protect the children, as well as all children who have Medicaid and CHIP coverage, and ensure that the intention of these government and public health funded programs continue to support the health of all of Colorado children. And our final priority in our health work area is protecting immunizations for Colorado's children. There continue to be ongoing frequent changes to things such as vaccine schedules, vaccine recommendations at the federal level. And Colorado, thankfully, has been doing our work to maintain that stability and maintain evidence-based resources for families and children. The legislature passed legislation already last session, and we're excited that Senate Bill 2632 has been introduced, which is going to continue to ensure that immunization access for all Coloradans. The bill is up for a hearing today. The Children's Campaign is actively engaging with one of our wonderful board members who will be testifying this afternoon. And the bill itself will just help continue Colorado on the path of updating statutory language, ensuring that nothing changes here in Colorado based on political changes, and we continue to follow this science-backed and data-backed research that supports immunization choice for all children and families. With that, I'll pass it over to Sarah.
Hi, everyone. Good morning. I'm Sarah Barnes, and I'm our VP of Policy here at the campaign. And I'm going to talk with you now about the campaign's priorities this year to protect families' economic security. So, starting with a look at the proposed budget from the governor, there are several proposals this year in that budget that are related to stabilizing and modernizing Colorado's safety net, or the public benefits that support families in our state, and also allowing Colorado to respond to that federal uncertainty that Heather mentioned at the beginning of the presentation. These proposals include a few things. First, they include regionalizing counties into districts in our state for administering certain public benefits in the safety net. Also included is using performance-based contracting to drive outcomes from spending in our safety net programs. It includes centralizing certain functions like call centers or document scanning. So those are happening in a centralized way in our state. And lastly, it includes a proposal to modernize all of the technology that we use to manage our public benefit system. So these are big proposals. They came out in the proposed budget and they came out in sort of separate proposals. The way the Children's Campaign is thinking about what needs to happen in Colorado right now is as follows. Colorado needs to be able to do the following things. First, we need to be able to address immediate issues in Colorado that have been created by the passage of H.R. 1, and those are primarily in SNAP and Medicaid. Second, we need to be able to be more flexible as a state to respond quickly in the face of this continued federal uncertainty. We need to reduce costs in our programs, and we need to increase their efficiency. And we also need to increase the program's effectiveness, so the way that these programs are serving families and how well they're doing that. The proposals I mentioned that are in the governor's budget are moving us in the right direction on these goals, and we are working to align and coordinate all of these proposals. We're also working to make sure that the proposals address the full scope of short-term and long-term changes that we need to make in Colorado to truly achieve these goals. And finally, we're working to make sure that we avoid taking a siloed approach here. And one great example of that is that we believe early childhood needs to be included across each of these proposals. There's also a specific proposal in the governor's budget this year for changes to our TANF program to promote sustainability in that program and prioritize families with the greatest need. And I'm going to talk a little bit more about that on the next slide. So a top priority for the campaign this year and has been for several years is stabilizing our TANF program and strengthening it for the long term. This needs to be part of the larger effort I mentioned on the previous slide to stabilize, strengthen, and modernize Colorado's safety net, of which TANF is a part. TANF, or the Temporary Assistance for Needy Families program, supports families who are experiencing extreme poverty, so making less than $15,000 a year, through cash assistance payments, as well as other services and supports. I'll note quickly that the recent decision by the federal administration to freeze TANF funds to Colorado is a great example of why Colorado needs to be able to be more responsive in the face of federal uncertainty. So the governor's proposed budget includes some ideas about how to stabilize TANF in Colorado. First, it proposes moving the cash assistance component of TANF, Basic Cash Assistance, or BCA, to be budgeted for and administered at the state level rather than at the county level in Colorado. This action would prioritize families with the deepest need who are eligible for BCA and ensure that BCA continues to be a priority in Colorado's TANF program. The governor's budget also proposes pausing the cost of living adjustment for BCA for 2 years. The Colorado Children's Campaign has concerns about this proposal, given that BCA is really critical for families in extreme poverty. These payments are modest, and they were not adjusted for decades for inflation before 2024. It's also true that a new study of those BCA increases in Colorado just came out and found that these BCA increases reduced the amount of churn in the TANF program, or families coming on and off the program, as well as the length of time that families were enrolled in the program, which indicates that these more substantial payments are more effective in moving families towards self-sufficiency. And we understand the need for talking about cost containment right now as a part of stabilizing the TANF program. We're having conversations about a path forward here that can minimize the harm to TANF families. And finally, the budget proposes to reduce the amount that counties can hold in TANF reserves. So this would help ensure that more TANF funds are making it directly to the families who need it. In addition to these immediate cost containment proposals, we also need to prioritize TANF spending on strategies that are backed by evidence, and we need to require outcomes to be tied to that spending. This will help modernize TANF for the long term and make sure we're prioritizing how we spend our limited TANF dollars in the most impactful ways. The proposal in the governor's budget I mentioned this year to implement performance-based contracting is heading in the right direction here. And we just need to make sure that we're moving toward measuring outcomes that really move the needle for kids and families. Another top priority this year for the campaign is to protect tax credits that bolster families' economic security and reduce child poverty, like the child tax credit and the family affordability tax credit. The Family Affordability Tax Credit, or the FATC, alone reduces child poverty in Colorado by almost 21%. And when the FATC is combined with the child tax credit and the earned income tax credit, those credits reduce child poverty by over 40%. This has significant positive impacts on child well-being, and it also supports Colorado's economy. HR 1 caused a huge hit to our state budget and to the FATC. And as a result, the credit will be turned off for tax year 2026, or when taxes are filed next year. And according to the current forecast, will only be partially available in tax years 27 and 28. Colorado needs to find ways to keep funding credits like the FATC despite a state budget picture that's really tough. And so we need to think innovatively about ways that we can create situations for us to be able to do this, including by looking at modernizing our state's tax code, closing select tax loopholes. We are partnering really closely this year with the Colorado Fiscal Institute and Gary Community Ventures on this effort. And at this point, I will turn it over to Mathangi Subramanian, our Director of Early Childhood.
Thank you, Sarah. So I'm Dr. Mathangi Subramanian, but you can call me Mathu, and I'm going to be talking to you today about all things early childhood. So we're going to start today by talking about the budget, and we're going to start with some good news. This year's early childhood budget includes a $14 million inflationary increase to UPK dollars, which will expand our ability to serve Colorado's 4-year-olds and select 3-year-olds in the Universal Preschool Program. It also includes a new line for early childhood councils, which are local governance structures that have had an unstable funding stream in the past. These investments are extremely important for expanding and improving services for kids and families, and we're really glad to see them in the budget. Now for the bad news. Our main issue with the early childhood budget is the lack of a long-term plan for CCAP feasibility. So taking a step back, CCAP is the Colorado Child Care Assistance Program. It provides subsidized childcare to about 27,000 Colorado kids who are low income or who have other qualifying factors. Currently, CCAP is overtaxed. There are waitlists and freezes in 19 counties, affecting almost 13,000 kids. In some cases, these waitlists and freezes have gone on as long as 18 months or longer. Although the state has proposed cuts of about $4 million in quality services, which they plan to funnel into direct services, this is not enough to stop the waitlists and freezes, which CDEC said during their budget hearing may cost over $100 million to fix. In 2023, our state stood up UPK and drastically expanded our early childhood ecosystem. We need that same kind of bold, innovative thinking this budget season to make sure that our state can weather operational chaos, budget cuts, and other unexpected obstacles while maintaining childcare funding for our most vulnerable families. So to talk a little bit more about CCAP, currently, as I said, there are about 13,000 children on waitlists and freezes, and we are especially concerned about TANF families who may not be getting the services they need to fulfill their work requirements, as well as other vulnerable populations like unhoused families or families who are part of a substance use disorder treatment or pregnant and parenting teens. Because of the federal funding freezes, we're in an extremely precarious situation. We don't have any kind of reserves or runway to serve families if those dollars do get frozen. This not only highlights the need for a state investment in our childcare system, but also highlights how we have to use the dollars we have more wisely. So this session, we're working to improve the way that CCAP is administered by looking at ways to reduce administrative costs and funneling more dollars into direct services. A key piece of that is including CCAP in the conversations that my colleague Sarah mentioned about regionalizing benefits like TANF. We're looking at these not only to increase the number of children and families who receive services, but also to ensure that providers have stable funding streams that they can rely on to keep their doors open for private pay families who use their services, as well as for CCAP families. Speaking of provider infrastructure, we have 2 bills this season that improve the affordability and accessibility of childcare to Colorado families by reducing red tape and streamlining systems. Senate Bill 19 combines early childhood councils and local coordinating organizations. So ECCs and LCOs have overlapping responsibilities in statute, including maintaining the quality and accessibility of a provider ecosystem and connecting parents and families with services. This bill combines these entities into early childhood councils that now have a clear scope of work created in partnership with the Department of Early Childhood and strong accountability metrics that communities can use to hold these entities accountable for their local work. Our other bill, Senate Bill 20, establishes a task force to analyze our early childhood quality system. The bill also contains several provisions that lessens provider burden, like reducing the red tape around local permitting requirements, encouraging the digitization of files, and improving our inspection process. All of these provisions will make it easier for providers to open and stay open, stabilizing our system for everyone who gets childcare regardless of their income. Our final policy priority this year is renewing the childcare contribution tax credit. So the childcare contribution tax credit is a major source of income for childcare facilities throughout Colorado. The tax credit allows donors to receive half of their contribution back when they make a contribution to childcare centers, and it's capped at $100,000. According to the Colorado Department of Revenue, in 2023, the CCTC generated over $60 million. In my conversations with providers, I've heard of providers who use the credit to raise money to stand up new centers and seats, recruit and retain talent, expand existing services, and keep their doors open so families can have consistent, high-quality care that they can count on. So we're asking for a 10-year renewal of the credit through House Bill 261004. This year's renewal is especially important given the federal funding freeze and the waitlists and freezes on CCAP. In speaking to providers, we found that many centers use this tax credit to keep children enrolled in care, even if families lose their child care benefits through CCAP or take on families who are not getting care because of the waitlists and freezes. Given the waitlists and freezes right now, this is an extraordinarily important revenue source that we cannot afford to lose and we must maintain. So together, we hope that this bill package streamlines the early childhood system, maximizes our existing dollars, and stabilizes our provider network so that all Colorado families have access to the affordable, high-quality childcare they need to let their kids be kids. And with that, I'll turn it over to Maddie, our Director of K-12.
Thanks so much, Matthew. I am here to talk about the campaign's last three priorities. These are in K-12 education or for the big kids. So we can't talk about K-12 education without talking about the overall state budget. As we've discussed, lawmakers will need to cut about $800 to $850 million in state spending to balance the 26-27 budget. Though K-12 is the second biggest piece of the Colorado state budget pretty much every year, the governor and legislative leadership have all publicly and repeatedly committed to not cutting K-12 this year. However, the plan that the governor put forward for filling this year's $800 million hole is not looking very promising right now. Even with limiting Medicaid spending growth and shoring up the state's safety net programs, the state still has some tough decisions ahead, and we're not making any promises about how K-12 is going to fare in those discussions. I will add that declining enrollment and increased local share will allow the state to reduce 26-27 K-12 appropriations by about $100 million, but that's not a savings because that money will need to stay in the state education fund for use in future budget years. There are a couple of longer-term K-12 budget solutions on the table this year in the form of two ballot measures. One proposes creating a graduated income tax to generate more revenue for the state to spend on K-12 and other priorities. Another proposes taking K-12 out from under the Tabor cap, which would free up about $4.5 billion each year. Both of these measures have a long way to the ballot. There's a lot that needs to be finalized and determined and discussed about these ballot measures, and neither of these proposals are going to help us with this year's budget problems. So we won't have final K-12 budget numbers and therefore won't make any final K-12 budget decisions until the March revenue forecast. When those negotiations begin, however, the campaign will be front and center with our top K-12 priority, which is continuing implementation of the 2024 school funding formula. So we are in year 2 of a 7-year phase-in for the new school funding formula enacted in 2024. If the new formula sticks, if we can get this to stick, it will be one of the biggest wins and one of the biggest funding drivers Colorado kids have seen in decades. It'll drive about an additional $500 million to public schools in Colorado each year, and it will do so equitably. This means that schools serving higher numbers of students living in poverty, students learning English, or students who have special learning needs will see the greatest benefit or the greatest funding increases driven by the new formula. This is known as student-centered funding, and it's a research-backed way with a strong reputation of closing opportunity or outcome gaps sort of across the board and the spectrum in K-12. Obviously, ramping up school funding according to the new formula inside budget shortfalls and federal uncertainty is going to be difficult. And it's going to require careful negotiations and some close monitoring of our fiscal situation this year. In this year's School Finance Act, we need to make sure that the new formula is working as intended and that the state can sustainably and predictably increase funding for schools according to the 7-year phase-in plan. A big part of keeping school budgets whole is keeping their nutrition budgets whole, and this brings us to our second K-12 priority. So the campaign has always been a big supporter of two key social safety net programs that work together to keep Colorado kids fed. Those are SNAP and HSMA, or the Healthy School Meals for All program. You've probably heard a lot about SNAP lately. It's a federal program that helps low-income families purchase food. Over the summer, Congress enacted SNAP provisions that ultimately put an estimated 165,000 Colorado families at risk of losing access to the program and to the food that it puts on their tables. In the last shutdown, the federal administration froze the state's SNAP funding. The legislature quickly stepped in to appropriate $10 million to food banks, but we learned that the state's food system isn't really designed for sudden cash losses or infusions like this. Food justice advocates are also preparing for more freezes in the future. You've also probably heard a lot about HSMA, or Healthy School Meals for All, as well. Originally enacted or created in 2022, HSMA was a very successful and popular program that uses state and federal funding to reimburse schools for providing 2 meals per day per kid every day. Food costs and the demand for the program really quickly outmatched the program's original funding mechanism, Prop FF. So proponents went back to the ballot in 2025, and Colorado voters voted overwhelmingly to support 2 tax measures to ensure the continuation of the Healthy School Meals for All program. However, HSMA is built on top of SNAP and Medicaid. As those federal funding streams start to sink or shrink, HSMA will sink or shrink with them. After the passage of H.R. 1, the legislature quickly acted to use a projected surplus in HSMA funding to shore up funding for SNAP, but there's a lot of decisions that need to be made about how to do that the right way to keep bellies full. So this session, the campaign is going to be focused on that, figuring out how to make HSMA and SNAP continue to work and to continue to feed Colorado kids through the next budget cycle. Lastly, the campaign is prioritizing students with disabilities this session because over the last year, families, educators, and advocates have faced growing uncertainty about how students with disabilities are being served and protected. Federal reductions in force and program closures have significantly weakened the systems responsible for enforcing disability rights. Offices charged with protecting students are understaffed, backlogged, or at risk of further shutdowns. So the Children's Campaign is partnering with Disability Law Colorado to step up and fill this void. Rather than waiting for federal capacity to be restored, Colorado is stepping in to provide continuity and certainty. We're working on a bill that ensures that core protections under Section 504 and IDEA remain fully enforceable in our state, regardless of federal staffing levels or administrative disruption. The bill does this by embedding those 504 and IDEA protections directly into Colorado education law and statute, and by creating reliable state-level processes for training, oversight, and complaint resolution. Each district already has trained, staffed, and designated 504 coordinators. This bill would direct additional resources to those 504 coordinators for additional training, additional parent outreach. Parents will receive clear notice of their rights and safeguards during this transition, and most importantly, when violations do occur, families will have a predictable, timely path for resolution through the Colorado Department of Education rather than having to wade through the federal mess. Again, this is not about expanding mandates, it's about preventing gaps. In times of federal instability, students with disabilities should not bear all of the risk. And the bill that we're working on provides a stable, no wrong door system so families know their rights and are protected today, tomorrow, and in the future, regardless of what happens at the federal level. So with that, I'd like to open the floor to answer any questions our audience might have today. Again, please use the Q&A feature to submit those questions and help us answer as many as possible.
All right, thanks, Maddie. It looks like we only have one question so far, and it's from Mathu. Erin is wondering if the LCO and early childhood councils are combined, will this allow for increased staffing at these agencies?
Thank you, Erin. Thanks for that question. I'm so glad you're on the call. Thanks for being here. So we are hoping that it will realize some efficiencies. I think every group will make their own decisions about how to use the funding. It is not an increase in funding, but we're hoping that because things are combined, there will be some savings. So I know that's not like a direct answer, but we are hoping that the current bill will help with the funding situation, and that local entities will have the flexibility to hire if they want to, but we're not mandating what they use the extra money for.
Thanks, Matthew. Any other questions? You're just so clear. These things are so simple. Oh, okay. If an organization is stepping into policy and advocacy, where do you recommend we direct our efforts? And are there statewide coalitions or groups to join? Maybe you all can answer that.
I'm happy to take a first stab. This is a really great question that we at the campaign really appreciate receiving from folks in our community. I think the first thing to remember about our advocacy and policy work this year, as we're dealing with all of this federal uncertainty, is to remember that it's less about being right and more about finding the solution that works the best for the most amount of Colorado kids. There's a really big difference between personal policy or the policy that works best for you from your perspective and public policy. And remembering that we're trying to get everybody kind of swimming in the same direction and keep kids safe during this federal chaos is really important. There are a lot of statewide coalitions and advocacy groups to join. The Colorado Statewide Parent Coalition is a great way to get plugged into some of the K-12 issues. Um, there are policy and advocacy groups organized by the Colorado Education Initiative. And then, of course, staying in touch with the campaign, signing up for our newsletters, and reacting to probably many of the federal action alerts that we'll be sending over the next 6 months is another great way to get plugged in. I'll open it up to my colleagues for other ideas and advice.
For early childhood, we have a monthly community call that we do. And we also have a mailing list that provides lots of opportunities to engage with national and state coalitions. John, would you mind putting a link to the form to sign up in the chat? And I can do it as well. And I think that's probably the most robust coalition here in Colorado right now, statewide. If you join that mailing list, you'll find out more national opportunities as well. And thank you for the question. We need everybody involved right now.
Yeah, I also love this question, and I would just add that if folks are interested specifically in TANF, there is a TANF coalition listserv, and you should feel free to send me an email if you're not on that list and would like to join and learn more about issues that are happening specifically in that space.
In the healthcare space in Colorado, we are just incredibly lucky to have so many incredible organizations and coalitions. And so maybe echoing what Sarah just said, like, please feel free to directly email me and I could kind of send a lot of connections. But a little bit to touch on what Maddie was saying at the front end too, is find what you're interested in and how you want to engage and take a look at the organizations that are doing things that you're interested in. Many of them have action alerts, newsletters, and community coalitions to engage with, in addition to just here at the campaign. So kind of depending on your area, look into those organizations and reach out to them. Anybody would always be happy to have another person in the work. So
Thank you all. I think this might be, I'm not sure if this is a Maddie or a Matthew question, but with state preschool funding being pulled out of the School Finance Act and moved into the preschool program cash fund, there are growing gaps between what districts receive for older grade students and what preschoolers with disabilities receive in state funding. Will you be addressing this?
I can answer that, Maddie. Is that okay? Okay. So preschoolers with disabilities receive more funding because the per student allocation is always more in the early grades. Younger kids just cost more because they just need more support. And I'm a former teacher. I used to teach high school, and I can tell you that we needed a lot less in terms of infrastructure for older kids than you do for younger kids. Also, children with disabilities require more funding, and often that funding comes from federal funding streams like IDEA. And so the cost is always just going to be more for both younger kids and children with disabilities. And when you combine them, it's just a much higher cost. Maddie, is there anything you want to add to that?
No, I think you nailed it, Matthew. This question has sparked some curiosity for me. Getting a clear sense of the weight or the additional funding that the state is supporting to students with disabilities across and between early childhood systems and K-12 systems would be hard to track, right? It would be hard to make a straight apples to apples comparison there. I can say that one of the big wins of last school year is that for the first time in the history of Colorado, the state directed $250 million in formula funding to support students in K through 12 with special learning needs. So we're making progress here. The comparison is tricky, and Mathu and I think, can publicly agree to look into some sort of comparison so we can understand how that funding changes over the course of a kiddo's life. I think that's a really point. I'm going to go on a curiosity voyage about that.
Awesome. Thanks, guys. Matthew, it looks like you're answering this, but I'm gonna have you answer verbally as
Yeah.
well. Are LCOs and ECCs supportive of the bill to combine?
Yeah, that's a great question. So LCOs have been at the table with us negotiating this bill from almost the beginning. Also, it's important to note that of the 35 LCOs, 32 of them are already combined. There's only 3 that are not combined. The LCOs have an open line of communication to us, and we have been working with them to address their concerns. We have several parts of the bill that address their concerns. For example, we have a clause that allows subcontracting so that if there are counties who want to maintain the current system, they can do that for as long as possible. I think one thing that I have heard from many LCOs, however, is that there are quality standards coming online for UPK. And if we did not combine these entities, then the LCOs would have to do this quality work. And this is not like something that I've done quantitative research on, but just from speaking to most LCOs, they're really good at the navigation work and very invested in it, and they want to keep doing that. And so combining the two really is great for LCOs so that they can focus on the work that they do well. And again, we're still in the process of negotiating this bill, and when the concerns come up, we are really interested in addressing them. And you guys have an open line of communication to me. But the majority of LCOs are already in the system and are pretty happy with the bill.
And we've been working with ECLA on this bill the entire time.
Yes.
All right. I think there's some comments based on this other question. I'm gonna actually not. If you want to follow up about the pre-K student rates and UPK, PPR, and all of that stuff, I would suggest reaching out to Maddie and Matthew. Johanna, can you speak a little more about the challenges with getting the proposed K-12 budget out of Tabor? Where can we put our efforts to advance this? Do we have support from our teachers unions, support staff unions, and school boards? Matt.
Yes, this is a great question, and we need all the help that we can get to get any ballot measure to better fund K-12 schools over the finish line. So thank you for asking. Great Education Colorado is working very closely with the Colorado Education Association. That's the biggest Colorado teachers union, to get very clear about how we are going to pull K-12 out from under the Tabor cap and how we're going to successfully get that ballot measure over the finish line. CASE, CASB, there are a lot of educators and educator adjacent organizations that are working really hard on this and are really dedicated to getting this done this year. The challenge of getting K-12 budget spending out from under Tabor is that it's difficult to frame the question on the ballot in a way that makes sense or speaks to sort of the average Colorado voter, right? I think everyone on this call and everyone in this world has really deep knowledge and experience with Tabor. That's not necessarily the case with all citizens across the state. And so when you go, to like your grandma, or you're talking to maybe your 8-year-old nephew about this, which I do frequently, explaining what the Tabor cap is and how removing K-12 education funding out from under that Tabor cap creates money in the state budget. It just takes a little bit of extra effort and work. So that would be my first answer. Make sure that everyone in your circles, everyone that you know and love, gets it, gets what Tabor is, gets why Tabor makes it so hard for us to adequately and appropriately fund K-12 schools, and gets that taking K-12 funding out from under the Tabor cap is a really good, viable solution to funding schools adequately. And again, getting in touch with Great Education Colorado's work and leadership in getting this over the finish line is a really great place to look.
Thanks, Maddie. There are several ballot initiative kind of things popping up that we did not address today, and I did see that Alexis put the Protect Colorado's Future website in the chat, so you can check that out as well. That's a group that is working on a graduated income tax, which would be another way to chip away at TABOR. All right, it looks like we're at the end of the questions, unless any more pop up. This was great. Let's do our last few slides here, and if any questions come up while I'm doing these, we'll answer them, but otherwise we'll wrap it up. We always want you all to stay connected with us. If you want to scan our QR code, you can get signed up for our Kids Flash newsletter. We are all over the socials, so please follow us on Instagram, LinkedIn, Facebook, TikTok. We're on TikTok, all the things. And then also we have been putting out action alerts. We actually put one out on these funding freezes. And when we put those out, we try to be very judicious about when we do an action alert. So please, when you see our action alerts, please respond to them and submit something. We had an amazing response to our action alert around the CCAP and TANF freezes, and the power shows. And we actually followed up with letters to our congressional delegation, and we heard back from almost all of them. Almost all of them signed on to a Colorado specific letter. So those action alerts really matter. So please continue to respond to them. We're gonna go to the next one, John. I said this at the beginning, we are doing a series of these webinars, so please save the dates. Our next one is on March 19th. And then our final one on May 15th, which is the day after the legislative session ends. So please join us. We'll be doing a similar thing that we did today. We'll give you an update on where everything is on March 19th and then let you know how everything ended on May 15th or March 19th, sorry. And then we have Speak Up for Kids coming April 8th. Please join us. We had a great turnout last year. We want to make it even greater this year. We will spend the morning at History Colorado learning about advocacy and some policy issues, and then we will head to the Capitol to do some lobbying, and people can have the opportunity to meet their legislators. So join us April 8th. And then I think that's it. All right. Thank you all for joining us. I don't see any other questions in the Q&A. But always feel free to reach out to our team. They are amazing. They know lots of stuff. And we love to answer questions. We love to be challenged on our thoughts. All of those things, please reach out whenever you want. Thank you all so much. Have a great day.